Well, thanks so much. I continue with part of the topic that was sent before by Javier, but with another point of view. I want to show a case of my case of a colleague of mine, in which one have a complication with overfill or too much fat cells survive, and in the way I can get successful with the laser treatment. I don't have any conflict of interest. Well, how much of our fat filler will survive? It's a question that I made myself. I suppose many of you make yourself in any kind of procedure of fat filler. Takumawa and Collaro tell us that in 1 centimeter, there's a lot of cells, 1 million adipocytes, 1 million tissue, stroma, 1 million vascular endothelial, 1 million of other cells like macrophages, lymphocytes, pericytes, and fibroblasts. And a friend of the house, Cohen, tell us that you can measure well the size of this parcel of cells in macrograph up to 2.5 millifat to 2.4, microfat 2.5 to 1.2, nanofat less than 1 millimeter, between 400 to 600 microns, and the adipocyte cells have a size between 50 to 150 microns. In the same article, he showed us that is a fact that during the first 1-2 months, there's a decrease of the size and decrease of the amount of these fat cells, close to the 50%. He found 49.6. But it's a fact, too, that he followed this patient up to 80 to 24 months, and they found that increased again this volume due to the stem cells, due to the stem cells, too. He increased the size and the volume close to the same size that he was injected. And I proved that in one patient of mine. I applied 4 years ago in the patient have a lipotrophy, central lipotrophy in the face by HIV medication. And I restored the volume with fat cells. This is the control after a year, a complete year, as you can see here. But more important that I followed the patient 3 years after that. He increased weight. He is close to the obesity, more than 10 kilos. And increase the size of the fat cell too. That's why, because they survive and they act and have the same behavior of the fat cell of the rest of the body. Well, talking about that, this is the case of the fat grafting overfill. This is the patient of a colleague of mine, 58 years old, female. She looked for a facelift. My colleague offered at the same time malar and lower palpebral growth fat filler. He told me that he used millifat over the orbital rim of the orbital bone rim, and he used a microfat in the subcutaneous way in arterial throat. He used like a sandwich. After a complete follow-up of the patient, they're still on our field, an excessive survival of the fat filler cells, especially on the orbital rim. The patient have an upset with that, have an argument with my colleague, mentioned the word lawyers. That's why the colleague asked me for help, mentioned that I usually use mini-invasive treatments like laser, microneedle, etc., and said me if I can offer her a non-surgical solution because she refused to go to the surgical room again. This is the case, and you can see here, as Javier mentioned, the sausages. Oh, sorry. Again. You can see here the sausages in the front view, and I asked to the patient to look to the roof and increase the size of the sausages. And I offer you two kinds of solution, surgical and non-surgical solution. The surgical solution, as you know, the best one, excision by direct approach, you can see and you can cut anything you want, or aspiration by cannula is a blind procedure. The best one, as I mentioned, excision by direct approach, have the problem that you leave a scar and you need to go to the surgery room. There's no chance to do it at the office. The other one you can do at the office, but you have hematoma, and it's impossible to have a great quantification of how much of the fat cell you retire. Maybe in some cases you can obtain a depression. You are the responsible of depression in the area. No surgical solution. They are chemical melt. There are complex enzymes. I don't have experience with that. Lipase, collagenase, and hyaluronidase. They use it to reduce the fat cells. Corticosteroid, we know that, but you have the risk of, especially around the eyes, in the eyelids, to obtain an atrophy of the skin. That's what is really risky. And they are thermal melt by technology: microneedle, HIFU, and laser. Pros and cons. All of them, I can do it at the office without anesthetic in the case of the enzymes. Again, it's difficult to quantify the resection because in the moment you apply the enzymes, it starts to work and you don't know how much is going to eat of these fats, and can cause skin atrophy too. The thermal melt at the office, you can run step by step. That's why it's really safe. And the problem is the cost of the device. From all these possibilities, I choose the laser. I have experience with laser. I use a diodo laser because I have the possibility to have many targets, like melanine, hemoglobin, and water, and it's flexible. I can use it inside a cannula and go directly inside the skin of my patient. This is the classical wave of length wave of the diodo laser between 800 to 1,500, and I choose 980 because I have affinity for hemoglobin and for water too. This is the proof that if you use that in vitro, you can melt. If you have sound, I don't know if you have the sound here, you can hear. Well, it's the same as you put the bistec on the barbecue and you hear the fat cells start to melt. There's a risk if you put really close to the skin to have a permanent scar, that when you need to have a skill to use it. And it's important to you go parallel to the skin, because if you apply in a oblique way, you want to appear out of the skin and leave a scar. And here's the case again, and here is the solution. I use an avocado. I leave any kind of scar. Here is the way I prove the amount of energy that I want to use, 10 watts in this case. And I can emulsificate the fat cells as I want, in one step, two step, or three step. In this case, it's only one step, only one session. Sorry, it's better if I can hear the way I emulsificate it. And this is the proof, this is the solution. Here the close view to measure well the way I reduce the sausages. In my opinion, I want to have the opportunity to have another session. I offered that to the patient, but she started to have an argument with me. That's why I stopped, because it's only for free. It's only to help my friend, and I take the photo. It's good enough for me, and I don't have any news for the patient for many months. After 6 months, this is the other profile when the patient look to the roof and the way they prove that the sausages are disappear. My take-home message: even in the best hands, even all of us have this situation in any moment of their life, or maybe you have this problem in the past, and that's why it's something that you need to have in mind. And that's why I offer you not only surgical solution that on our hands for sure is the best one, trying to look for another solution to avoid any kind of argument with your patients. And in my case, I offered you the possibility of EBD. I show successful results, and keep in mind, that's why, again, no surgical possibility for these cases.